Welcome to Goal Getter, the AAP Physiotherapy Podcast. My name is Jen Pantelak, and I'm the CEO of the Alberta Association of Physiotherapy. This show explores the power of physiotherapy, helping individuals move, heal, and thrive. Let's get moving. For most people, hearing physiotherapist brings to mind sprains, sports injuries, or post-op rehab. But if you've ever spoken to a burn survivor or been part of their care, you know just how essential physiotherapy is from the very first days after injury all the way through recovery. Today, we're very fortunate to be joined by two special guests: Alex Chisholm, a burn care physiotherapist who follows patients on their journey, and Jason Matthews from the Calgary Firefighter Burn Treatment Society, who brings the firefighter and community perspective supporting survivors. Thank you both for joining us today.
Thanks for
Having me.
having us.
So let's just dive right in. As I said earlier, many people don't realize that physiotherapy is involved in burn care. How often do you hear, like either of you, I don't need physio, I have a burn?
It's people are very surprised, especially as an outpatient when they come to the outpatient burn treatment area, that it's a physio that's treating them. They typically expect a nurse or somebody else, and when they realize it's a physio, initially they sort of go, "Why is it a physio?" And once you explain what we do, that we do wound care, we do dressings, we assess the burn, we're part of a team. If there's a bigger issue, we'll be bringing them to the team. We'll come to them essentially. Then after a few treatments, they understand. But it is very common that people are surprised. As an inpatient, people tend to be more accepting because they see so many different disciplines. They'll see social work, they'll see, the nurses, they'll see the plastic surgeons, they'll see the physiatrists, they see a whole gamut. So having physio come as one of the allied health isn't such a surprise, but they don't really know what we do. When they meet us, they don't really know what does that mean. So that's in common, but it tends to be a much bigger of a surprise where somebody might go, but my back's okay. Why am I seeing a physio?
Right. Is there anything you wish the public better understood about the role that a physiotherapist plays in wound care or in burn rehabilitation?
Yeah, I think I didn't even know when I first started physio that we did burn care. So it's not really surprising, although that was a very long time ago when I started. Very long. Um, but it's not really surprising that the public doesn't know because it's just not out there that much. And I think what I would hope that over time the public will learn is not only does a physio have their physio degree once that they have chosen to go into the burn care area, there's a lot of extra training that happens. So I'm really fortunate that at my facility, our administrators support us to do a lot of training. So new people that come onto the service are basically training for 8 hours a day, 5 days a week for at least 6 months, and then we never stop learning. So I think that's the other thing about physios. We're always learning. We're always looking to be better today than we were yesterday. And that training includes wound care. So how do wounds heal? What happens with the burn? How deep is a burn? How do we tell if they're infected? How do we decide what's the best dressing? And how do we prevent, the biggest part, problems from that burn? And I think another thing that the public tends not to understand is how complex they are. So pain is one of my areas of passion, and my sort of little tag is pain. Pain is not just a tissue issue, meaning it's a whole person issue, but I would argue that burns are not just a tissue issue. And typically people think it's only about the tissue that's been burnt. It's about the person who has the burn, not just the tissue, because that burn affects many parts of their life, whether it's a smaller burn or a much bigger life altering burn. It affects not just the tissue, but all the parts that make us who we are.
Absolutely. And you kind of alluded to like understanding the role of physiotherapy. When someone's admitted with a burn injury, what does that early physiotherapy support look like?
So it probably depends on the continuum of care. So, assuming you have a burn that doesn't require you to go to ICU, so you would have had a burn significant enough that either you came from Emerge or another facility and got admitted, or we're seeing in our outpatient clinic, sometimes we will see a burn, we will recognize that this is a burn, that physiotherapy is not alone is not enough, and we will call for help and then get admitted. So the first thing that we'd be doing is basically assessing how much you can move and also whether it's appropriate to move. So if somebody's just had a surgery and they've had a skin graft, we don't actually necessarily want them to move the part that's been grafted. So it's, is it appropriate to move? Can they move? And how do we best preserve their function? So the art of a burn physiotherapist is to see the problems that are going to come, not just the ones that are in front of you. So my patient maybe can't get out of bed. That's sort of pretty obvious. But what are the problems that are going to come if they don't move? So my job is really to see the problems that are coming and make sure we avoid them, whether that's with exercise, mobility, dressings, pain care. There's a whole variety of things we might use, but we want to be able to see the things that the patient doesn't know is going to happen and try and prevent the problem versus treating it once we have it, because burns evolve. And if you have a significant burn today, a year later, you may still be dealing with that burn. So we are wanting to look into the future, and our goal is always to get them back to their life, to get them back to as normal of a life as they had before. And that depends a lot on the burn, how big the burn is, how deep the burn is, what was required to be done. But it is always our goal to figure out who are you, what matters to you, and how do we get you back to the things that really matter to you, because everybody's a little bit different. If a patient's in the ICU, they might be, unconscious, and basically it's doing a lot of passive work. So that might be positioning. One of the things that happens with patients is their burns tighten over time. So if we don't keep their arms out, for instance, so we might have to position them with their arms up. If we don't do that, they're going to make it become so that they can't move. And people, I don't think, realize typically if we don't maintain mobility, you lose function. So we recently had a very unfortunate young lady that was lost to follow up. So she didn't get care. And when we saw her again, she couldn't move. And that affects life. She couldn't pick up her baby. So it's really important that you get the right care at the right time so you maintain that function. And when the patient goes from ICU to the unit, physiotherapy would follow them, because there's physiotherapy in intensive care, and then there's physiotherapy on the unit, and there's physiotherapy as an outpatient. And then even when those patients are discharged, we're lucky enough, very lucky, we have the Calgary Firefighters, and they support our peer support program. And we have a support group that's once a month. So there are physiotherapists that are facilitators of that and will still be there. So the patients may be 10 years out, but you will still see them at those groups. So it's a long continuum of care for a burn patient.
And Jason, do you want to maybe speak a little bit about that support group and that continuum of care and how that fits into the picture?
Sure. So the Burn Treatment Society here in Calgary, we support the burn unit and burn care, and it goes everything from education to peer support. I mean, I think a lot of the things we do, better equipment, and as we all know, there's limitations on what is provided for healthcare workers, and we try and take that to the next level. And I think one of the things that through through government funding, there isn't a peer support program, and we've all learned over the years, myself included, how important that is. I know Alex alluded to it before, but certainly it's a journey, and it's a lifelong journey for most people. So having that peer support group after that, their or even during their recovery, that continues. So we're really big on that, to funding that in more ways than um, more and more ways that we can find possible. So not just the monthly meetings, but we also help support. Like we do a Christmas dinner we have coming up next week. We do a burn survivor picnic, um, and we have some plans in the near future for some other like social gatherings for younger burn survivors, as well as the entire group here in Calgary.
That's so wonderful. And do you see some of the people kind of continuing to be part of that community and almost maybe like mentoring people as they come in and are exposed to that peer group?
Yeah, absolutely, and it's interesting because we see people sometimes come and go. They might disappear for a couple of years and then they show back up at a picnic because they need that support. They feel they need that connection. And I mean, I've seen it a lot. I mean, and I certainly don't think um, this one person in particular would mind like mentioning the name. Kyle Hines is a burn survivor here in Calgary. He's a real leader amongst the community. He was burned as a young man in Eastern Canada and has since migrated to Alberta. And he's really taken over things. And he spends a lot of time at the hospital visiting burn survivors, new and old. And just recently, within the last year, there was a young guy in his late 20s. He was injured in an oil field accident and had been spending some time at the burn unit. And he told me that afterwards that at one point he was badly injured, that he was wanting to give up. And
Mhm.
Kyle came, sat with him for half an hour, 45 minutes, talked about some of the things that he had been through. And this other patient said that was life changing. It sent him in a whole new direction. And and even the better part, I was up at the hospital just a couple months ago visiting another burn survivor, and this other guy was in there talking with him, doing the same thing, giving him some support, guiding him what it's going to be like once he gets out of the hospital, how he can move on. So definitely we find that in Calgary, and we have some other people who've been burned 20 years ago, and they still make visits to the hospital. They still provide peer support. So it is, I mean, you'll probably hear this lots, but it's like definitely a family um,
Mhm.
that we're all a part of.
I would echo that. I would say that we are incredibly fortunate to have the firefighters support our peer group because things that affect burn survivors, there's physical challenges, there's psychological challenges, but there's also social challenges and economic challenges. So just paying for parking so that they can come, or making it now that we have a room where we can do Zoom visits. That means if you don't have a car or you can't afford the gas to even get there, you can still be part of that monthly meeting. That is huge. And we just presented at the Canadian Burn Conference just recently. And I don't think I realized till we did that presentation how unique we are in Alberta to be able to have this, and specifically with the Calgary Fire Guys to have this integration that is so rare. And as part of that presentation, I interviewed burn survivors. And I must say, it was hard not to cry actually when you listen to what they said. And really, that word of family, it came out again: family, family, family. The other thing that came out was life changing, just as you said. And I mean, we have survivors back in the day when I started this in 1987, actually. So I was started doing burns back then. And Don, who ran it for many years, was part of it. And he's still there. And he was, when we interviewed him, it was family. When you interview the new survivors, it's still family. And I think one of the other things that was so just amazing was consistently their survivors said that after the physical recovery, their reintegration and emotional recovery they felt was directly related to being able to have these shared resources that are, we wouldn't be able to do it without the firefighters. But this integration of both the entire continuum of people that are required to do burn rehab, but for these survivor picnics, we even have a fellow that comes from Saskatchewan with his 3 kids, all the way driving from Saskatchewan and back for these things. So it tells you how fortunate we are to have that, and how true healing is that whole continuum from physical to emotional, which is why burn are not just a tissue issue, they're a person issue, really. It's the whole healing. But it is truly remarkable when you see the support that they gain from each other. And also, we learn from them. And when we go to the groups, so we facilitate a group, and there's usually 2 healthcare providers at the group. One of the things is we are learning from them. They know what we bring, the intellectual stuff, but they can teach us a lot. And we
Mhm.
call this the circle of care, where we're learning from them, they're learning from us, we're learning from each other. And that's when you really have a community that really respects each other, and the survivors are part of that. I'm a better physio because of all that I've learned from the survivors. That makes me better every day because I learn from them.
That's so wonderful, and I think, not only the opportunity for healthcare workers to learn from survivors, but to your point earlier about being able to learn in that shared experience,
Mhm.
it's very unique from other injuries that someone
Mhm.
may, like, experience in their
Yeah.
lifetime, so being able to connect in and to understand, you know, I'm not the first person to go down this road, and this is how others have helped, or being able to ask questions, I think sometimes is really important
Mhm.
too. Like, have you experienced this yourself, and how
Yeah,
did you overcome this unique challenge?
yeah. 'Cause there's a lot of stigma. I will never forget, I think, Jason heard this before, is I will never forget the patient that said to me, we were one of the things we will sometimes do, when you have a patient that is really anxious about going out into public because people stare. There's lovely, supportive people, but there's people that are much less so. And one of the things we work on is how to get them back out into the community. That is part of physiotherapy. And we were working on how to cope with things. And she'd gone to a restaurant and they'd asked her to leave because they said people are trying to eat and they can't eat when they're looking at you. So, can you imagine what that does to a young girl? You know, I don't think it would
Yeah.
matter if you were 83 if somebody said something like that to you. So, being able to listen, hear that experience, but for them to be able to go and ask, how do you handle it? To come back and say, I want to role play some of these things, try it. So that really shows how it, that whole circle continues. But that it, we often think that when the burn is healed, it's done, but it's not. It's only part of the healing. Getting people so that they can go out, go to a movie, go to a restaurant, go play sports. We a couple of years ago had a burn survivor at the Canadian Burn Survivor Conference, and he said it took him years before he would go swimming. So burns have a long sequelae. They're just not as soon as your tissue is closed, you're done. There's
Mhm.
in a bigger burn, there's more to it.
You've both alluded to the fact that burn care is incredibly collaborative. Who, outside of physiotherapy and the peer support groups, who are the other key players on a burn team, and how does it all fit together, the pieces?
So typically, I would say I'll start with the inpatients. So the inpatients have the biggest team. So I'll speak to that if that's okay. So
Yeah.
there'd be physio, there'd be occupational therapy. In my opinion, that's like right and left hands. I don't really think I could manage without working with OT. Social work, we have the most amazing social worker. There's dietitians because the amount of calories you take in have to be higher if you're healing a burn. So we have a dietitian as well. We will also have, obviously, the nurses. We are very, very fortunate. We have a nurse practitioner, we have a nurse educator, and we also have all the physicians. So you may have a plastic surgeon. We have an amazing physiatrist, Dr. Vince Gabriel, who does a lot of research. So that's another thing that the firefighters really help us with that we could touch on later. But he will also see the patient as an inpatient. If you've lost a limb due to the burn, you may have somebody that does prosthetics. So the team is huge. We have a psychologist. If they need it, we have psychiatry. But we also are lucky because we also have an outpatient burn psychologist. So not everybody has that ability, but we are very fortunate that our admin supported that. So it is a very big team, but we work really closely together. So when you get in in the morning, you're talking to the nurses like, when is Mrs. Jones getting her dressing done? When is Mr. Peters getting his whatever done? So that you can integrate what you're doing. You also integrate it with the other professions. Is when is OT seeing them? When am I seeing them? Do they need their splints done? So it's busy. Typically, people think that there's just nothing to do. No, it's a pretty busy time when people are getting their rehab, and then depending on where they are in their continuum, we may also want them to have a peer visitor who will come into the hospital. Again, that SOAR is supported by the firefighters, and may come on and visit them in their room, as you heard about Kyle, or they may just want to come to the meetings in the evenings if they want to do that. I think we also have music therapists as well. So we've been lucky to have a wide variety of supports for our patients. But burns is a team effort because unless you are a very small burn that comes to physio as an outpatient, goes to emerge, gets sent up, we know that you're going to heal in 2 or 3 weeks, then that's probably you need us. We can tell you what to do. But if you're a burn that we think is going to take 4 months to heal, you're going to be seeing a much bigger team. You're going to be seeing the OT. You're going to be seeing the nurse practitioner. Our nurse practitioner is unbelievably wonderful. She's fantastic. So we will have the nurse practitioner. We have Dr. Gabriel, our physiatrist, come to our clinic. So we run clinics twice a week as outpatients. So you will see the whole team if you have a burn that requires that. Did I forget anything, Jason? Can you think
No,
of something
I
else?
think that covered it well. I'll just add kind of that family aspect, all those people that
Totally.
play those roles within the hospital that Alex is talking about. All those people, not, I mean, we see those same people at the, let's say, the burn survivor picnic. So surgeons, OTs, occupational therapists and physiotherapists and social workers. These people are also spending their time away from the hospital with the burn family. So whether we're doing the burn survivor picnic, we do a burn survivor walk with the summer solstice, Christmas dinners. It's the same group of people, and everybody is coming out for these. Also, I mean, as like a fundraiser, the Burn Treatment Society last year we did a truck pull in downtown Calgary. They pulled people, teams of 10 pulled a fire truck. We had teams from two different teams from the burn unit. We had a team of burn survivors, and of course, a bunch of firefighters around all working together. We had a team from the University of Calgary Vet Med, who we support a project there. They put a team in as well. So we're seeing each other outside of that hospital setting, which I think is important for all of us, and most importantly for the burn survivors.
I would say that's very true. I didn't realize how much of a community it is when I was the firefighters presented at the Canadian burn that just we recently had. And one of the things one of the firefighters said was, I know the families. I know Alex's husband, and now the survivors, because we've been going to these things for so long. They will know my husband. And they come chat to him. So it becomes this family where you see the kids come, you see the family come, but that is part of this community that makes sure that people integrate back in to what it is that they love and supporting them through that. And I think the support they get from each other, but also I think we get that support as a healthcare firefighter community, because healthcare isn't always the easiest place to work. And I think having that sense of mutual respect, we lift each other up when we might have a down day. And I think you feel a sense of purpose, and that makes a really big difference.
And Jason, you've given a lot of really amazing examples of what the Firefighter Burn Treatment Society does to support survivors, families, hospital teams. Um, can you elaborate a little bit more? Are there any other programs that you're really proud of that the society or that even individual firefighters do to support this community?
I mean, yeah. So a couple different things that uh, we also support would be education. So there's a variety of in-house training for nursing staff here. We have a high percentage of our nurses here in Calgary are burn trained, which not all centers throughout Canada have, which is great. Um, we also support a chair in skin regeneration at the University of Calgary Vet Med. So they're actually doing some very interesting research, and they're actually using um, reindeer for the research. So reindeer are very interesting. If they suffer a burn injury on their bodies, when it heals, it scars. However, on their antlers, they're made of something. They're a bit different, and almost to 100%, if that area of a reindeer is burned, it comes back scar free. So they're using some of the information that they're learning from that, hoping that they can go forward, and they're doing a lot of great things already with on other mammals, and they're making a huge progress, and they're actually finding ways that they can do that as well with skin regeneration in other animals. So that's one of the things that we certainly worked with. And then the firefighters as well. A couple other things that we do now. We've started just recently doing a little bit more with the Alberta Children's Hospital here in Calgary, pushing them towards having some better treatment for young people who suffer burn injuries, as well as we support the Alberta Firefighters Burn Camp, which is a camp for 7 to 18-year-olds burn survivors who have an opportunity to spend a week with other burn survivors, and that's a huge hit for them, and a great opportunity for like the family once again kind of to get together and something else for us to support.
Yeah, that would be so impactful, I imagine, for those youth to be able to connect with peers who've been through a similar journey.
I think you also help us with like through the lab and the research at the university. There's a lot of like stuff that sort of bench to bedside. So Lindsay, our nurse practitioner, did some studies on skin grafts to learn like what is the experience of having a skin graft. So if I see somebody that we think is not going to heal, say as an outpatient, we think, this is going to take way too long. One of the new things that we have is the laser Doppler that I think we got support from the firefighters for. So it is a way that we can look at how much blood flow do we think is there that will allow us to make a better informed decision about what somebody would need a graft. The Lindsay's research helped us realize, do people understand what that means? And a common myth is that my skin will look the same after I've had a graft. And grafted skin never looks the same as it did before the burn. And that's part of the educational component that the physio has to take them through. We're also testing now how elastic are those grafts. That's part of it. And there's also burn disaster planning. And I think Danielle, who's our clinical nurse educator, has basically just recently this year got the burn disaster program for Calgary. So if there's a big explosion somewhere and we have tons of people hurt, how are we going to cope with that? And that was some of the research that came out of there. And now they're doing a lot of research on those people that are unhoused, because we've had an increasing proportion of our clients are now people who are unhoused and have their tents have caught on fire for whatever reason. But she's doing research on that. So all that work helps us make our treatment better for our patients. We learn when we can get these educational opportunities, how do we better care for them? And we have equipment to better care for them.
Right. It goes back to your feedback loop from earlier, just how important that
Exactly.
is.
It's just this continuous, lovely thing.
Yeah. So you've both shared some pretty incredible stories. And Alex, I know prior to this, you shared the lion dancing video that we'll post in the notes along with this episode. Are there any stories or a specific story that stand out for either of you? Maybe a moment that reminds you why this work is so meaningful?
There was a young man who suffered some bad burn injuries approximately like 3 years ago now, and I mean his journey continues. He's found his way back to work as an electrician, um, out of the workforce, and he's done really well for himself. And I mean, every time I see him, it's like he's taking like another step forward in some aspect of his life. And just recently, we had a fundraiser, and we had 300 plus people there. And he got up on the stage and he told his story to that group of people. And I was standing with some of the other people with burn treatment, and I mean, it almost like brought a tear to my eye. And I looked at Thomas, our president, and I said to him, I mean, like, this is exactly why we're doing what we do, is because from this young man who just under 3 years ago was literally clinging to life in the hospital, to standing up there telling his story and supporting fundraising for burn care. So I mean, that was a pretty special moment recently that really like tugged at the heartstrings, and like definitely a memorable uh, happening for me.
I'll build off of that. So you mentioned the line dance. So, um, and what we do as physiotherapists. So I think I put a lot of thought into this. So I think when we're asking somebody who's had a very big burn to move, if they don't move, they're going to lose function. So the things that we do that we take for granted, getting dressed, go to the bathroom, eating, they won't be able to do it. And sometimes your goal is, I want to sit on a toilet. But sometimes your goal is, I want to sit. Simple, basic things. And one of the things I think that we strive for is, if you are burned, I saw this quote that said, burns equal pain. And I thought at the beginning, that's a lot of what it's like. And then I'm the physiotherapist. I'm going to come in. I'm going to say hi. I'm going to tell you what I'm going to, why you need to see me. You can always say no, because they always have the right to say no. The skill is to make sure that you can work together and that they're going to do what you ask. So their body's screaming and saying, do not move. This hurts. Why would I move this so hard? They need to trust me more than they fear the pain. So that they have to trust me more than they are frightened of the pain. Because if not, they won't move. And if they don't move, you end up stuck in like that lady that couldn't even pick up her own baby. So it's really important. And the young girl that was doing the video, when we saw her, it was very difficult to engage in physio because she just had enough, understandably. And I admire all survivors, because I'm not sure I could do it. So I feel it's a privilege to work with them because it's an honor. You see such strength. And strength isn't that it's easy. Strength is you do it despite how darn difficult and terrifying it is. You still, and you trust your team and you go forward. And for this young lady, she lost a leg, she lost all her fingers, and it was really tough for her to see a purpose. And at that time, when she could not even sit, one of our goals was for her to get a hug from her dad. And I remember the time she cried out for me when we started doing this thing called conscious sedation. Because I've been there so long, I thought one day, why don't we do range when they're really not so aware of what's going on? And while she was under sedation, she said, Alex, I want a hug. I want a hug. And it made me think, again, learning from your patient, is that how long has it been since she had a hug? And she said, it's been 6 months or maybe 8 months since my dad has ever been able to even give me a hug or touch me. Nobody's given me a hug. So that was our goal, to get a hug. And so we managed to get her on the edge of the bed. We got her dad in, she got a hug, and people left. And I wondered why some of them left. And they said, because they were all starting to cry, like the care team. And later on, I interviewed her because I was asked to do a pain presentation, and I hate death by PowerPoint. So I thought I'll make it interesting with patients. And one of the things she said that meant the most to her, and she literally said, it meant more to me than the first hug from my dad, which I thought was impossible. Like nothing could mean more than that first hug from your dad. She said it was seeing how much the care team cared. She saw that we teared up. She saw that people were, overwhelmed with emotion. She said knowing that she had that team around her, that meant more to her than anything, which made me realize it matters that they know you care. Like there's that old saying, nobody cares how much you know until they know how much you care. But I think it's because they feel safe. They know that you have their back and you're going to work with them for whatever matters for them. And for her, one of her goals was, and this was somebody who had not, did not have a lot of higher education. She wanted to teach. She wanted to teach about how to treat her. And after she was discharged, we were actually able to present together. There was a big, huge conference at Lake Louise, and she and I did a presentation where she taught them what are the top 10 things a patient needs you to know. And I remember saying how meaningful it was. She said this changed my life and I just thought, she's been through so much and she achieved this goal. And very similar to the gentleman we saw at Ignite the Night. It's just so moving when you see that.
And just so powerful, like to your point about that patient-centric care and listening to your patients, and to your earlier point, Alex, figuring out, what's those goals. And for many, it's those simple things in life and being able to reach those. And sometimes it's right, the micro goals in between to get to that bigger goal.
And different people, if we see them as an outpatient, there's a huge continuum between people that have benefits and cannot work and people that got burnt at work and feel like they can't take time off. And you have to figure out, okay, realistically, sometimes it's the rent or work. Not everybody has a job where they will have sick time or whatever. And sometimes it's figuring out, okay, what can I do so that this person can still manage? It's figuring out, how can I help them with that situation? So there's such a huge continuum between where we would see somebody, we look at their burn, we assess how deep the burn is, what's the best dressing. Because one of the things people don't know about physiotherapy is you're looking at a wound to see how deep do you think that wound is. Is that a superficial wound that's going to heal quickly? Is it a wound that is going to take a bit longer? Or is it a wound that we think may need some surgical help? Because you scar much more likely to scar the longer your wound is open. Genetics play a role, but typically speaking, if we can get it healed quicker, that's preferable for the patient. But there's such a huge continuum, and part of what we're doing is looking at what dressing we put on there. So we would make the choice when you come in, do you need this dressing, that dressing? So it's a knowledge of the dressings. It's a knowledge of when do you use compression that would help reduce swelling. When do you need to immobilize somebody? There's a lot of things. It's simple saying get back to function, but the nuts and bolts of it are very complex. So you need a lot of extra training and knowledge to put those pieces together for that individual person. And I think most people don't know too that we would, if you have a burn that has blistered and there's a lot of dead tissue, your physio may be cutting that tissue away. Like, people are usually really surprised to learn we may get out a scalpel and we are just cutting away the dead tissue. That's within the scope of physiotherapy. You have to have extra training to do it. You cannot do that if you're junior and you've just started. But we're trained to learn, when do you take the blister off? When do you not take the blister off? What dead tissue has to come off? What does not? What is the best dressing to go on the top of it? Plus, we're also looking at so they can move, because you often see these people come from a different setting and their dressing is like huge, and it's like they've got giant mitts on and they can't eat, they can't drink, they can't go to the bathroom, and they certainly can't move. And we're going to be doing something very different because we want motion, typically speaking. So it's looking at all these pieces and how do they fit together, and also how do I make them feel safe, because I don't have drugs to give them as an outpatient. As an inpatient, that's a different setting. But when they see me as an outpatient, one of the things they typically think is that there's going to be medications, and that's not within our scope. We can call somebody that can give them a prescription, but we can't give them the meds. So it's up to us to create a safe environment that makes them hurt less so they can do the things we need to do.
Right. And then also taking into consideration as you're working with these patients, it evolves as they heal, and
100%.
being mindful of, okay, what's that next phase or that
Yeah.
next step in this
Yeah.
journey of healing?
Yeah. 100%. It changes. And that's one of the things I tell the patients: what we put on today is not what we're going to put on tomorrow necessarily. Like, it may stay the same, but it may not stay the same. And one of the things Jason alluded to is, we talked about community, and that as healthcare providers, we're a very strong community. One of our OTs even did a fundraiser at McMahon with High Fitness Nadine and firefighters. So I think we got extra people there because the firefighters were exercising too, which was a great fundraising opportunity. But it's
Unless you saw them trying to like dance to the music, it was God impressive.
I'm coming to that one next year because that sounds like it would be fun. We're going to invite Jen. Um,
Please do.
so it's also, the community is their caregiver, because burns don't just happen to the person that got burned, whether it's your mom or your child or your partner, and that dynamic changes. And one of the things we tend not to think about is, you know, if you can't hug someone, if you can't touch someone, there's so many parts to burns that people are unaware of. And sometimes one of the things is the facial burns. We give facial exercises. You will, encourage them to use their splints, because if you can't move your mouth, you can't speak properly. You cannot eat. But the other thing is, can you kiss your partner? All those things. Can you touch your partner? How do you feel about that? And it's amazing how much, you need to create a feeling of safety where somebody can talk to you and say, this has changed, where they can feel safe in their peer support group to say, how do you handle that change? And especially when people are first discharged from the hospital, you're the caregiver on either side. And that is a very different thing. So we are very fortunate that we are able to, at our SOAR peer support meetings, have the caregiver come too. And they too can ask questions like, how did you cope? Because there's a lot of fear of, when you don't know for sure what the outcome's going to be or how you're going to heal, what it's going to look like. There's fear on both sides. And so having that openness to community. And when we did those interviews, that was one thing people said over and over again. It's important that I can come, but it's also important the person I love can come. Whether that's my mom, like, you see moms coming, you see, sisters coming, you see their partners coming, you see a friend coming, but whatever that support is for them. And it's also important if they don't have that support, because when they come to us, we are there for them, but we don't go home with them. We give them the tools for when they go home. That's my job. Give you the tools so you can, whether somebody's learning how to do the wound care, we will teach them. So we have a handout, the physios, and sometimes the OTs will go through how to do that dressing if they're an outpatient. But we will give them the tools. That's our job.
Well, and I think that's such a valid point in terms of the caregiver being involved. Especially, I think about young children.
Mhm.
Our daughter experienced a very minor burn, but I was so grateful for like the resources and the support that we were given to make sure that we were setting her up for success as she was healing and going through that journey. And of course, as a parent, you have
Yeah.
101 questions. So
Yeah.
being able to have that
Yeah.
space and that time to
Yeah.
ask and and to be able to
Yeah.
really understand what was happening, I felt was so valuable.
I think there's this quote that I really work to retain, and it says, it's about surgery, but it says minor surgery is the surgery they do to somebody else. When it's to you, it's not minor. And I think burns are like that. So people will come with a burn, and just because it's small, it's typically not minor to them. And it's sometimes the patients with the most questions, I will look at them and I think this is going to take, I'll be done in 15 minutes, 45 minutes. I'm still in there, but they're still got questions. So doesn't mean it feels minor to them, even though, it might not be large. And that can be very valid depending on where it is. So if you have burns, like one of the things you don't want to do is go through the drive through at Tim Hortons, take your coffee and put it between your legs. Because when that bursts open and you can't get out your door because you're by the drive through, and then you pull forward and you realize you don't want to pull off your pants in front of the drive through, those burns can be very unpleasant, even though they're not that big. So, where the burn is, especially if it's over a major joint or in a hand, that can make a big difference.
Both of you chatted a little bit around like the education piece and burn care awareness being really important. Is there anything that you would love to see happen in Alberta to expand our current burn care awareness or education?
I mean, I can think a little bit about some of the things that we do have going on here. So uh, the Calgary Fire Department collaborates a lot with the burn unit and the Calgary Firefighters Burn Treatment Society to support the community for community education. Uh, One of the things that they've done in the last couple of years, I mean, it was just one more thing that kind of flowed through the burn unit with a bit of a research project for the university student, was reaching out to like new Canadians and some of the challenges that they have in our city, coming to, like, whether we have different ways of cooking, cold weather cooking, things like that. We find, as the fire department, we get fires because of that, so we're seeing more burn injuries, and we're attending more calls like that. So there's like that education piece, I think, is good. I mean, this is like always one mind from the fire department, and we have kids come in all the time for tours. And one of the things I like to ask the kids is, how many of you sleep with your door open? And usually half the kids will put their hand up, and their door's open. And we say, this is something I ask them to go home, and you can have your door open, but when your parents go to bed, you need to close the door, because it's a huge safety issue. The difference between sometimes life and death, or just like a major injury for somebody, might be a closed door if the fire's elsewhere in the house. Because we've gone into homes where there's a fire, and you have blackened walls all the way, let's say, up to the second story of a home, and then you open up. I mean, sometimes it'll be like a child's bedroom, and you open it up, and it's just perfectly clean because the door was closed. So there's no smoke stains or anything like that. The bedding is perfectly clean, and somebody could have survived that or not been injured. I mean, that's just like one of the small things that can make a big difference, that I always like to pass on. It's a simple thing, and I think it's something that parents don't realize, because, I mean, you want to be close to your kid, have contact with your kid, but it's something that can be life changing or life saving.
I remember having a patient who was a firefighter, and he told me to close my door. And it was probably 20 years ago. I still think of him when I shut my bedroom door, was he said to shut the bedroom door. I One of the things that I would like to see that we don't yet have, um, is there was just a recent article published that was talking about maybe getting better information to family physicians, simply because they don't get a lot of training in burns. It's the second most common trauma, apparently. It's very common to get a burn. And also, we have a sort of tagline at the hospital: any burn, anytime. And we're very lucky. Like, we are very fortunate that we've had administration, a head nurse, a manager of rehab that has supported us. And so I think people would actually be surprised. So if you get a referral to our outpatient physio clinic, we see 44% of people within 1 to 2 days. And we see the other 44% of people within 2 to 4 days. So we do see people on the weekends if it's an emergency. We just run regular hospital hours, like 8 to 4:15 sort of thing. But we see people in very quickly if we can. But you do still see patients that aren't sent back in because they have no pain. And I mean, it's 3 weeks later and it still doesn't hurt, but that's because it's a full thickness burn. So people perceive the more painful it is, the worse it is. And sometimes pain is actually a good sign because it's not as deep. So there's a lot of misconception in the community sometimes about when something needs to be referred to us, and also the consequences of a big burn. So if you have a big burn and then you're discharged home, it can affect your cardiovascular system, it can affect your muscles, it can affect your bone density, you can have pain, you can have itch, almost every system, hormonal. So I would love to see what they have in Quebec, which is a little handout that is easy to access that tells family physicians these are the things that it can affect, just because that would help with patient care. And the other thing that I'm not sure how we would ever do, but there's apparently a way to do more education for those who are unhoused, because that really has been a huge source, as well as all the things. I would agree with what Jason said, is because we have had more we see a lot of people. I think in 2024 we saw 1,734 visits for burn patients. Like, that's a lot when there's only 2 outpatient physios. So that's a lot. So, how do we, there is no magic fix, but is there a way to put information out there, such as shutting a door when you don't have a door? Like, how do, maybe, but that's a big problem. So I'm biting
Mhm.
off more than I can chew there, but those are some ideas.
You'd mentioned about referral and the better education to family physicians. I even just thinking about general public, someone at home has a
Get a
burn,
burn.
and it could be something, right, they
Yeah.
think is minor.
Yeah.
Um, for the listeners who are listening, when should you seek
Seek.
physiotherapy or other support for a burn? Are there any signs or symptoms that you should be like, I shouldn't ignore this. I need to go and seek medical attention?
Yeah, there's some general rules. So no absolutes, but cool it, but don't put it in ice. So I've seen somebody who had a burn that wasn't that bad, but the frostbite from having his hand in ice for 24 hours was pretty nasty. So do not stick it in ice for prolonged periods of time. Just cool it, put a non-stick dressing on it, keep it clean. Biggest risk for a burn, if it's a sort of, well, any burn really, is infection, because we want to avoid that. So if you have a burn that is over a major joint, if it's significant on your face, if it's your hands, your feet, your perineum, those sorts of things, you need to go get seen. If you may have got an inhalation burn, so you're in an enclosed space and something goes off, you should get checked, but you should be going to emerge. So if you have big burn, you should be going to emerge. The emerge physicians will assess you and they will do what's appropriate. If you have a smallish burn, you could go to your family physician because they can refer you to us. Especially important if you can't move. So if it's over a joint and you can no longer move that joint, we need to figure out why. Is it just because the blisters are so big and we need to take them down, but they need to be seen? Also, if there's any signs of infection. So you may have a smallish burn that you think is going to heal. Fantastic. Keep it clean, keep it covered, non-stick dressing, but it starts to show signs of infection. So it starts to swell. You get redness that's spreading around the outside, and it's warm. Your pain has gone up. There's some weird discharge, especially if you start to feel sick. You should go to your family doctor, get them to see whether they think you need an antibiotic, and then they would refer you to us, and then you would become part of a clinic. So typically, if we see a patient that we think, this is going to take longer, on Tuesday and Wednesday mornings, we have a multidisciplinary clinic in our outpatient area. So that means we have occupational therapy, we have physiotherapy, we can call the social worker, we can call the burn psychologist, but we have our nurse practitioner, who's Lindsay, who's amazing, and we have Dr. Vince Gabriel, who's a physiatrist, and he's amazing. Our medical director right now, and he's done burns for years and he's known internationally. So we would book you into that clinic and you would see that whole team of people if we felt you were a big enough burn. But any of those worrisome signs, infection, your face, hands, feet, perineum, because then if you swell a lot, it's hard to go to the bathroom. So anything like that, or huge blisters, or a blister that looks like leatherish and it doesn't hurt. We see that more than you would expect, where somebody said, well, I didn't worry because it doesn't hurt. If it doesn't feel like skin, look like skin, and it feels more like leather, you need to get that checked.
Thank you. Yeah, it's just I think those are right. Often people will experience something they think is minor and it'll go undetected until it's like really severe. So thank you for sharing that, Alex. Jason, I loved your tip about closing a bedroom door at night as like a precaution. Could you maybe share another tip or two around some really good preventative measures that our listeners could maybe think about?
Yeah, I mean, I think some of these are like pretty basic things that we learn, but we also forget about. Like safety in the kitchen is something that we always talk about. Kids reaching up on hot stoves, pulling pots down on themselves. That happens often. Also, I'd like another thing that I think happens more often than not is some people doing some like cooking in a grease fire, and then they try and put it out with water. And I've been to like several calls throughout my career where someone has thrown water on it or thrown the pot and either started a larger fire or it splashed back on themselves and they've had large area burns on their body, down on their legs, and on their face even sometimes. So being careful around the kitchen, especially kids, but adults too, they kind of get in panic mode to kind of be a little bit prepared for what they might be able to do. um, that's one of the things. I mean, I think a lot of these kinds of things center around kids, but also teens. Uh, I mean, as we all know, teens are risk takers. Things like camping parties, things like that, where there's fire involved. I've seen a lot of young people over the years who've been injured. That sort of thing, being too close to a fire, falling in a fire. So make sure that you have a proper fire pit and are being reasonable around those areas. So those are a couple other ones that we see on a semi-regular basis where people get burn injuries.
Alex, prior to coming on today, you had shared a really heartwarming link with me with a burn survivor doing a lion dance at the end of her journey. And I thought that was just so impactful. And again, speaks to that idea of community coming together to celebrate at the end. Jason, do you want to share a little bit more about this semi tradition that's been started?
Yeah, so I think that was kind of the start of a little bit of a new tradition for the burn unit. So sometimes some burn patients end up on the unit for like a extended amount of time, and I think one and that was sort of the start of it. One of the things that we started to do is having a bit of a graduation for burn survivors. So as they're leaving the hospital, so to be a gathering of as much staff as that we can gather, a few members from the Burn Treatment Society, the burn survivor, their families, their support people. We all get together at the hospital. Maybe there's like some refreshments and some like a cake or cookies or something like that. And one of the things that we do is we actually present that burn survivor a coin. So it's a challenge coin, and it's the Calgary Firefighters Burn Treatment Society. So all the firefighters have one. We try and get all the staff on the unit to have one of these coins as well. And it's like a little bit. I mean, it's almost like a little bit of a membership. It's like you're part of this family, and you'll always be part of that family. So it's a great opportunity for everybody to get together, celebrate that one giant step in their journey. And I think also not just because it's not over, but saying now we're all these people in this room, your family, the staff here, the firefighters, we're also still behind you um, as that journey goes forward. And it's pretty emotional for everybody. But I mean, there's some tears, but it's also a celebration.
I
I love
would
that.
heartily concur with that. It's just a huge celebration. And that tradition started actually out of a patient really struggling. So that was back in the day when we had the hot stuff firefighters, and she was struggling with rehab. And I thought, you know what? Let's do something very out of the box. And she said she loved country music. So I said, you can teach me how to line dance. And initially she was stuck in her wheelchair. She could barely get up. She laughed because I'm such a bad dancer. So then we used the dance for balance. And I made a promise to her. I said, when you get discharged, because that led her to believe she would get discharged, when you get discharged, we're going to line dance at your party. And I'm going to invite some people to the party. But little did she know I reached out to the firefighters, and she did not know they were going to be there. So when I said, okay, you're going to dance, when they showed up to dance with her, that just made all the difference in the world to have them there. So it kind of started that amazing tradition that we're really lucky that firefighters support us with that, because we wouldn't really be able to do it without them, and it really is important. And it sort of makes me reflect on how do we help as physiotherapists people when they get to the point where the pain is too much. They've been in the hospital sometimes for 4 months, and they've just, they can't do it anymore. And there's one of the patients I remember, he was a lovely young man whose wife was pregnant for the first time. And she was heavily pregnant at this time, probably 7.5, 8 months. And he just hit the wall and he said to me, I'm done. I don't care. Like, I can't do it anymore. And he said, I'm not going to do physio. And I said, well, I really thought, what am I going to do? Because there's sometimes where you're at a crossroads and you got to pick the right path. And I thought, you know what? I'm not going to do the regular physio. So I grabbed one of the boots that we put on people to stop them getting sore heels. And I took Coban, which is like an adhesive bandage, and I wrapped it up. I put on a face. I said, this is your baby. Your job today is you're going to put a diaper on this baby. We got a diaper. And I said, you're going to put it on because you're going to have a baby. He says, I can't do it. I'm like, I'm going to help you. So then we went and I found a baby and we got the baby. And I said, now you're going to learn to swaddle the baby. So we swaddled the baby. And then we ended up adding weights to the baby. It's because you're going to have to lift your baby. So now it meant something. So sometimes our physio doesn't look like 3 sets of 10. Sometimes it looks like, how do I get my hands moving? Because I'm going to have a baby. And how am I going to be able to look after it and mean something? So sometimes physio is really out of the box, but it's knowing your patient, knowing what matters, listening and being willing to do something differently. And for him, I think one of the most meaningful things for me was after he got home, had the baby. A couple of years later, he reached out and he said, I'm having another baby and I want you to come to the baby shower for that baby. You know that those things make a difference. Having those discharge parties that the firefighters support us with, and everybody celebrating together, that's really important. And that was a learning from me from that first party. Was so many of the ICU nurses came to me and said, I needed this. I didn't even know that, but they came and said, I needed to see why it was worth it. And I think that that's part of what bonds us as a community, as Jason said, everybody together, and why it's emotional, but why when we work together as a team, we have your back and we will get you to your goals, and we will keep fighting with you.
That's so incredible. And like there's the power of community and teamwork. And to your point, I could see that being such an important experience for the healthcare providers who've been walking alongside these patients the entire way, and to feel a sense of that accomplishment and to be able to celebrate with them and being just so valuable. And back to your point, like showing the meaning in the work, because some days it's not always easy and we know that. And so I think when you're able to celebrate like that, it's just it helps move everyone along.
And I think that challenge coin that the firefighters give them, it it has so much meaning in that symbol, because it does, like, I'm not sure, Jason, if you ever if you, like, I don't know what the words are to say how much that matters, because that's something they take home. It has no negative association, but they take it home. And I actually don't know if you've ever heard this story. There's one of the things I teach about is compassion, and how with compassion and understanding pain, we can sometimes change the experience. So one of the amazing, amazing nurses on the burn unit for the burn vest, so these are dressings that patients have to wear, went to one of the talks that we had done, and she just started designing things on top of the burn vest, and she took the firefighter symbol and she recreated it on a burn vest. And so he proudly wore this burn vest. Typically before that, it was a symbol of pain, so they don't like to see dressings. But when I interviewed him, because I like to use patient stories to help teach other physios or therapists, and when I interviewed, you know what he said, Jason? He said, I took that home and framed it
Oh,
on the burn net, the Firefighter Burn Treatment Society picture. Yeah. So that to him continued to give him strength. There was so much meaning in that. And I thought it was beautiful.
Absolutely. Thank you both for sharing. This has been a really like heartwarming conversation in a way, just like the impact of community and I think to me this is just such an amazing example of community at work and people coming together, burn survivors, current people going through the journey, firefighters, the healthcare teams, and all coming together to support and help all these individuals move forward. If there's one thing that you hope the public take away from a conversation today around burn care, what would that be?
I think for someone who's been burned, I think it's just like know that they you're not alone. There's a great team behind you, and there's like a family there with you, and so there. I mean, there is hope for you, and you can move on with your life.
I would echo that from a physio point of view. I would want them to know that your physio comes to you with a lot of training and a lot of expertise in many areas, and that our job is to work with you. I remember learning that from a burn survivor. The firefighters paid for me to go to a burn survivor conference in Halifax, and oh, I loved it. I still remember some of the stuff. And there was a fellow that got up there, and he said, and he had a strong um, reaction with his physio, and he said, "You need to remember, physio is something you do with somebody, not to them." And I thought that just is so perfect. Physio is what we do with somebody, not to them. We do it with them, with that particular person, because we have your back. We need you to know that we are there to get you to where you want to go, and we will keep supporting you until you get there. And for us, we're lucky we see the continuum from when you walk in the door to past when you go out the door, when we see you at the Christmas party, when we see you at the picnic. And when people are willing to drive from Saskatchewan to come to that picnic, we know that that sense of community is huge. And people go through their darkest day. We're there for that. We're also there to celebrate, because that's what Jason was talking about, celebrating seeing people do well. We get true joy out of that. And that is our goal, is for you to get back your life and for us to celebrate that. And we do that as a community. And I think we're stronger because of that. And I think we're really fortunate in Alberta, and especially in Calgary, to have this dedicated set of healthcare providers and firefighters that bring that sort of circle of care back.
That was beautiful. Thank you. And thank you both so much for not only coming on the show today to talk about burns and everything that's happening within the community, but for both of you, the work that you do. It's so incredible. And I'm very grateful to have had the conversation with you today.
Thank you very
Thanks for having
much.
us.
It was wonderful learning more about the burn community here in Alberta. If you're interested in learning more about physiotherapy or to find a physiotherapist near you, visit albertaphysio.com. See you next time.